afternoon, ladies and gentlemen. Welcome to our second part of the online KickOff event of Vision Health 42. Before starting with the exciting contents of our afternoon today, I want to say some words about our initiative about Vision Health 42. Vision Health 42 is an international initiative for sustainable healthcare in Europe. And behind this initiative, there are three companies: one company in Vienna, one company in Rome, one company in Hanover. So I want to introduce you these companies. It is the company Incanto in Rome, the company Permanaut in Hanover, and the company for CEU in Vienna. These three companies, we started this initiative because during the pandemic, we have seen that there are big changes in the healthcare sector, in the healthcare systems of the diverse EU countries because of the implementation of modern technologies, because of the implementation of digital health. The healthcare is in the competence of the EU countries, but all these changes and challenges are often the same in every country. Nevertheless, there are different speeds of the development of these new technologies and digital health in the diverse countries. And often this topic is discussed on a national level. And we said, okay, why not discussing it on a European level, and why not learning from each other? Because there are a lot of best practice examples throughout Europe, and it is good to look and see and make the things better in their own country. We want to start this European discussion from northwest to southeast in Europe. And we established an advisory board, and one member of our advisory board is Laura Wamprecht. She is managing director from Flying Health, and she gave us very valuable insights and inputs. And together we started a cooperation for organizing this afternoon today together. And we also discussed during the advisory board meetings, that digital health reimbursement is crucial for the development of digital health. And that's why we now want to start with a lecture about this topic, about digital health reimbursement in Europe. And I would like to welcome Serap Konak, Senior Partner Relationship Manager from Flying Health. Ms. Konak, Serap, hello, welcome at our online kick-off event from Vision Health 42. I would like to ask you to say some words about you, some words about Flying Health, and then I would like to ask you to start your lecture. Thank you. The floor is yours.
Thank you so much for the very warm welcome to today's session. So I'm Serap. I'm a Senior Partner Relationship Manager at Flying Health. And I'm very happy to be part of your event and to represent Flying Health together with my colleague, Laura. I'm a health economist, and I worked for the statutory health insurances in Germany for a few years until I joined Flying Health 6 months ago. So Flying Health, so within our ecosystem, we built a bridge between startups, corporates, and relevant stakeholders, transforming industry leaders and entrepreneurs into healthcare pioneers. And our partners are leading companies in their area of expertise to provide better healthcare. So, yeah, glad. The session for the next hour and a half is digital health reimbursement in Germany and other European countries. I have a few slides on the different reimbursement options for digital health products in Germany. And towards the end of the presentation, I will give a short overview of the options in other European countries. Given the short time, we will not be able to discuss the deep details, but it will certainly give a good overview. After my presentation, Laura, my colleague, will take over and moderate the panel discussion with 2 manufacturers for digital health. So at least that's the plan. I would say let's start. Roughly, we can divide the market entry options in general 3 ways. Business to customer, business to customer, and business to business. So business to customer is the very classic way for self-payer, often used by manufacturers for the beta version, while the product development processes. The prices in the self-pay market for health products in Germany are very low, and it is often not worthwhile for manufacturers. The B2B is very broadly defined, so there are various types of business models. The typical way is for startups to work with established companies or sell their product directly. For example, in the healthcare system for hospitals or pharmaceutical companies. Our focus for the next minutes is the reimbursement, so the B2B2C option. Here we have several options for the market entry: individual contracting and standard care, also called collective contracts. These options have advantages and disadvantages. So the B2B2C market is often the second step for a manufacturer after the product validation, once CE mark received and initial clinical evidence generated. The reimbursement can offer access to large markets and enables opportunity for sustainable price points to offset disadvantages of the self-payer market. But perseverance is needed. There are a lot of challenges in the highly regulated health care market. And the more important fact is that reimbursement doesn't mean such as. So after contracting, it is important to invest in marketing and sales in the direction of physicians and patients, because they have to be aware of your product. So otherwise, a manufacturer will only be reimbursed in the theory. So let's look at the different options in a little more detail. First of all, the individual selective contracts. Selective contracts are regulated in various provisions of the 5th social code, in German SGB 5. However, when we're speaking of selective contracts, the contracts according to paragraph 140a SGB 5 are usually meant. In contrast to a collective contract, a selective contract is a health insurance contract that is concluded between one or more health insurances and individual service providers or groups of service providers without any legal obligation. Contractual partners of the health insurance can be, for example, networks of physicians, medical care centers, or pharmaceutical companies, as well as manufacturers of medical products. And in special, also startups for digital health products. In the political discussion, selective contracts are also referred to as direct contracts in order to emphasize that the healthcare contract can be concluded directly between health insurances and service providers and suppliers. The involvement of collective institutions, such as associations of statutory health insurance accredited physicians, is not necessary. So for the Insured participation in selectively contracted care is usually voluntary and associated with enrollment for a limited period of time. Health insurances use selective contracts to make the health care of their insured more economical and qualitatively better in order to achieve competitive advantages. The manufacturers have to convince every single health insurance company of their product in order to be included in the portfolio. The application can be offered independently or in a patient journey with involvement of the respective specialists. The more parties are involved, the more complex is the contract and the longer the negotiation code. So, however, if a contract is concluded, it is to be expected that the contracts will be offered for several years. The insured must still be persuaded to accept the free offer so that the contract is actually lived. Reimbursement via prevention is also an option. So it can be either collectively contracted via ZPP, that's the Central Prevention Review Board, or selectively contracted individually per health insurances. ZPP is a corporation of statutory health insurances for the certification of prevention courses. The seal of approval is awarded in 4 files on action: exercise, nutrition, stress and resource management, and substance abuse, as certification for prevention courses that are recognized by the statutory health insurances. There are several digital health startups certified by the Zentrale Prüfstelle Prävention, ZPP. Nevertheless, for successful sales, it needs also a strong B2C business because the insured person often has to find the solution on his or her own. However, health insurances also use paragraph 20 to offer individual prevention solutions. Here, the insured are often approached directly about the new offer by the insurances. An important fact is prevention is not covered in the DIGA directionnaire. Prevention means here that the insured hasn't a diagnosis, so that's the main differences. Which brings us to the topic of DIGA and standard care. With the introduction of the Digital Care Act, there was a milestone in the reimbursement for digital health in Germany. If you look back in time, reimbursement pathways for most digital health apps were very fragmented in Germany. They used 2 different options since 2014, the ones we discussed just now. So providers tried different ways and forms to actually get into the market. Statutory health insurances tried also with not timely paragraphs built contracts which were criticized by the supervisory authority. This changed in 2020 when the Digital Care Act came into place. So law has been implemented fairly quickly. In 2020, the Digital Care Act legislation came into effect and specified an access for digital solutions to all of the statutory health insured population for the first time. So what I mean when I say all statutory health insured population in Germany, Germany's statutory health care system is the largest in Europe, with 73 million people distributed in 97 health insurances. The rest of the population is privately insured. That is about 9 million people in nearly 40 private health insurances. An important fact is that the Digital Health Act does not apply for the private health insurances. So that most attractive market access globally due to the amount of insured population that can get reimbursed. The Digital Care Act was globally the first statuted general process for reimbursement for digital health applications. So it's something that a lot of countries actually got excited about, that we have been sharing some thoughts and ideas on, because obviously this process is also not perfect yet. But when we talk about DiGA, what is a DiGA? It's an abbreviation for a very long German term, digitale Gesundheitsanwendung, which could translate in digital health apps. So there are 13 characteristics which are key and need to be here in order for a digital health app to be listed as a DiGA. The first step is to be a CE certified medical product under class 1 or 2A under the MDR. The main functionality release on digital technologies. This is important because it doesn't actually have to be an app. It could also be based on voice or web application. It hasn't been an app on your smartphone. But it has to be centered around the patient. You might include the doctor for it, but for instance, the decision support tool would not classify as DiGA. And last but not least, you have different types of product functionalities. So, for example, detection, monitoring, treatment, etc. There's a long list that could be targeted. So the other lovely abbreviation is BfArM, das Bundesinstitut für Arzneimittel und Medizinprodukte, the German FDA. The BfArM is responsible to review the application when a provider wants to become a DiGA. And when we look to general requirements, which you see at the top, which include things like CE certification, data protection and data security, but also user-friendliness and interoperability. And if you look at the bottom, you see there's a focus on positive care effects, and actually a DiGA can have two types of positive care effects, either medical benefits and or structural or procedural effects. You can see it on the next slide. Here's an example of what does it look like. I think in an international context to look out for, because when we look for patient-centered digital health apps, we'll often think about purely the medical benefits. But here is, in this case, in Germany, it is also possible only to look out to structural and procedural effects like health literacy, treatment coordination. Now, there are two different types to entering into the DiGA list. If you look at the top, this is focus on permanent listing. If you are a DiGA provider and you can already tick off the general requirements and positive care effects, you can apply to permanent listing. The BfArM has 3 months to tell you if your application is approved or not. And in this first year, you set your price yourself, and then you go into price negotiation with the GKV SV, which is the Association of the Statutory Health Insurance. If you look in the bottom one, which is particular in the German process, other countries are currently thinking about whether they want to include this or not. But you can also apply only with the general requirements without positive care effects. Then you are primarily listed and you have 12 months to generate the evidence. you need to specify what kind of positive care effects you want to generate. And if you generate the evidence in these 12 months, you go into the price negotiation. This is, as I said, particularly that I think is quite interesting if you look at other countries. So where are we now after 1.5 years of DiGA fast track? DiGA admissions increased more than 200% in 2021. The first one got improved in October 2020. You might remember that I said the Digital Care Act came into January 2020 and then took a little bit time until the application source was open and then the BfArM have to review it. So today we have 31 DiGA admissions. With 10 permanent admissions, we see admissions in all indication areas, but with the main focus on mental health. Here are 10 DiGA. Almost 40,000 DiGA were reimbursed in the first 12 months. And the most used DiGA were the tinnitus DiGA, and the second one was the physiotherapy DiGA, and the third one was the DiGA targeting obesity. So if we take a closer look at the prices, we see the following slide. The price per 90 days, as indicated in the DiGA directory by the manufacturers, varies widely between individual DiGA and within indications between 100 and 750 euros per 90 days. The average price is 415 euros. So here we see also the first international DiGA, Vitadio. It's DiGA for type 2 diabetes, and it's from a manufacturer from the Czech Republic. Overall, honestly, many stakeholders, especially physicians and the insurances, are very critical of the pricing. And it's an exciting time because in the last few months, there have been the first price negotiations with the GKV-SV, the Association of the Statutory Health Insurance. The prices already negotiated for Zomnio and Velibra are currently 48% of the original manufacturer price. So Elvida is currently the highest price drop with 1/3 of the original manufacturer price, while the Praxis started negotiation at the lower price point. All of them ended up at about the same price range, around 230 euros. So the comparative therapy and its costs are critical in the price negotiation. So why is the Digital Healthcare Act and the DiGA Fast Track in Germany relevant for several European countries? With the Digital Care Act, back in December 2019, our health minister, Spahn, established a clear focus on digital health. This set the stage for thinking about digital health as part of the care for patients. The DiGA Fast Track is already a blueprint for numerous discussions and European countries. The decision makers, on the one hand, are discussing mainly about processes, reimbursement, and quality criteria for digital health products, such as data protection and evidence. But if you can imagine, the manufacturers and investors market are reacting enthusiastically as European expansion becomes more and more likely. You might heard from the Health Innovation Hub, which is the hub from German Health Ministry. They presented a possible concept that divide the implementation of Europe-wide DiGA into 5 steps with different responsibilities. So you have market access, which has already a more European stamp with the European MDR and GDPR. You then have the application of manufacturer, their discussion on whether applications processes should be on the EU level rather than individual level. But especially when you look at not only medical benefits, but also the structural effects, it might be more complicated given the differences in the system. Then evidence synthesis. If we can have digital health app in Germany, can we also apply to some of the other European countries? And then obviously the reimbursement structure and price negotiation for the current view that will be more on a national level. At the bottom, you see all countries actually looking at it. We are in discussion with them, and the most prominent on is the next slide. France. France is the second country after Germany with a digital health reimbursement process. So Macron, who was recently re-elected, says we will also immediately create a market access producer for innovative products, the same way as in Germany. You will just replicate that what works in Germany. So the law was passed in December 2021. Digital therapeutics and telemonitoring will be reimbursable. So, and it includes medical device up to risk class 3. The French fast track offers 2 reimbursement paths for digital therapeutics and telemonitoring applications. Digital therapeutics must have a positive medical benefit, and telemonitoring could also have a structural and process improvement. This also brings us to the differences to Germany. There are some differences in DiGA fast track between Germany and France. You see in this list. So telemonitoring and prevention are, for example, not reimbursable in Germany, but in France. The risk class, according to MDR, is in Germany only 1 and 2A, and in France are all risk classes approved. So the preliminary listing is in Germany for 12 months, possible in France 6 months. But let's talk about another country, namely Belgium. So Belgium launched a system to cover digital health products in 2019. Since January 2021, there's a regulatory framework for the financing of medical apps in Belgium. Belgium assesses medical apps on the basis of a validation pyramid. So the pyramid has 3 levels. 1, the CE certified medical device. The 2, interoperability, and 3, reimbursement, the socioeconomic evidence. The higher apps want to get in the pyramid, the stricter the conditions they have to meet. Applications that reach the top of the pyramid, so level 3, can count on government funding. The pyramid is an initiative of the public-private platform mHealth Belgium. The 3rd level of the validation pyramid is also divided in 2 categories, 3- and 3+. Medical apps that are still collecting data about their health economic added value can already qualify for provisional financing via level 3 light. In this way, patients can enjoy the benefits faster, a system that is also used, for example, for innovative medicines. So Move Up falls into that category. Once an app from level 3 has proven its added value, it can end up in category 3+ and be reimbursed on the structural basis. Another example from Europe is Italy. Italy's digital health strategy currently focuses on establishing the national e-health infrastructure. Financing is available for digital services within the e-health infrastructure, but no clear pathways for digital therapeutic products has been established. So digital therapeutic solutions have not found widespread adoption, but the awareness is growing there also. So autonomous regions have strong levels of independence. The degree of digitalization varies significantly due to different levels of ambition in the market. The Nordics demonstrate general openness to digital health. Here is a strong use of telemedicine in many countries. And here is a general willingness to use digital health solutions, especially in Sweden and Finland. Hospitals willing to work with digital therapeutics. In Denmark, decisions made by each municipality, which does not make reimbursement across the country easy. So Finland and Sweden have some local programs, and in Sweden, they have additional digital physiotherapy subsidized by the healthcare system. So that was a high-level overview of reimbursement for digital therapeutics in Germany and a short overview of some European countries. I told a lot in a short time. I hope it was interesting for you, and thank you very much for listening. And please feel free to contact us also afterwards. I think it will be more interesting now to hear direct examples in the panel from the manufacturer's point of view, and hand over now.
Serap, thank you very much for your very interesting insights. And you're right, it was a lot of content for a short time. And next time we have to schedule a lot of more time for your lot of information. And also thank you for your very interesting overview of the developments in the diverse EU countries. It was very interesting. And thank you, and hopefully next time we will have more time.
Thank you so much. I'm very interested in the panel now. So
yes, me too. And now I hand over the micro to your colleague, to Laura Nelde. She's Senior Insights Manager of Flying Health, and she will be the moderator of the panel discussion about Going Europe, how digital health startups master their market entry in the multiple EU countries. Laura Nelde, welcome at this KickOff event, and I would like to ask you to say some words about you, some words of introduction, and then to start your panel discussion. The floor is yours. Thank you.
Thank you very much. Yes, I'm very excited to be hosting the panel this afternoon. So we already mentioned the title of Going Europe and how digital health startups can master entering multiple markets across the EU. I'm a Senior Insights Manager at Flying Health, so I work in the same company as Serap. And I've been with Flying Health for 4 years now, and I focus a lot on the startup scene. And of course, for startups, the topic of market access, market entry is extremely relevant. So that is also the kind of questions that I often deal with in my day-to-day work. And we have just heard from Serap on a lot of reimbursement opportunities and maybe also the lack of harmonization between different countries there. But I think, digital health startups are much broader than, for example, what is currently being reimbursed by the DiGA. There's more than digital therapeutics. So I'm really happy that I'm being joined today by 2 different companies that follow 2 slightly different approaches. And I think that will make for a great discussion in how these 2 enter different markets across Europe. So I'm happy to welcome Roxane Höck of WeFight and Marius Mainz from HelloBetter.
Hey everyone.
Hello, Laura.
Great to see you. So before we jump into the discussion, just one quick note for the audience. In case anyone has questions for these two or for our panel discussion, you're welcome to post them in the comments, and then I will pick them up and ask them as well. So you're welcome to join the discussion that way. Before we start, I think it would be great to just get some background on both of you, on what you're doing, where you work, and of course the companies that you work for and what they are doing. So maybe Roxane, we can start off with you, and you can just give an introduction on yourself, but also of WeFight and what the product is that you are bringing to patients and companies.
Great, thank you, Laura, and thank you for having me today. I'm very glad to be part of this panel. And yeah, to introduce myself, I'm Roxane Höck. I'm actually half French, half German. I'm currently a business development executive at WeFight. And looking a little bit more into my background, I've been working quite a lot more in the pharma and health world in the past 6 years, mostly in business development, so opening new markets in Europe, but also outside of Europe. It was Latin America, Southeast Asia, and North Africa. So very happy to be here. And to introduce a bit WeFight, because I'm also here to speak about specifically our market entry strategies in different countries here. We are a digital health company that is, the mission is to support patients suffering from cancers and chronic diseases by providing validated information, very easy to understand, and this 24/7 and instantly. And to give you a bit of insights, WeFight is a French company, so based in Paris, Montpellier, and more recently in Berlin. So the first international office. I'm actually speaking to you from Berlin right now. And since our creation in 2017, we have to date developed 26 different apps that are basically used in 17 different pathologies and in partnerships on one side with medical doctors and with patient associations. So today it represents 500,000 users, patients and relatives in countries using our apps, and we already work also with some of the big names in pharma and in Germany specifically Sanofi and AstraZeneca. So I stop here. I let also Marius Mainz introduce himself. Yeah.
Good. Welcome to Berlin, then. So yeah, hey everyone. My name is Marius Mainz. I'm a strategy and growth manager at HelloBetter. My background is in healthcare management and electronic health. I spent 1.5 years at Stanford Center for Digital Health and could kind of experience the digital health movement in the Silicon Valley myself. HelloBetter. HelloBetter is a Berlin-based company. It's actually a university spin-off founded in 2015. And since then grew to more than 100 employees at the moment. And we believe that mental health is a human right. And kind of to deliver on that promise, we want to make evidence-based mental health care universally accessible. And we do that by offering effective and scalable digital therapeutics for mental health. And as we are a university spin-off and we already have conducted more than 30 studies or clinical studies on our products, we were pretty well positioned for the DIGA model. And so that's why at the moment we have 5 DIGA approved by the BfArM in Germany, 4 of those permanent listed, 1 preliminary listed. And that's HelloBetter in a nutshell.
Awesome. Thanks for the introduction. To sort of finish off this background and have some context for the panel, maybe both of you could also just say which countries you're currently operating in. I believe so. I mean, we know your home markets now. It's France and Germany, but maybe are there other countries that you are already targeting? And also, or what are your plans in the future in terms of Europe? Which European countries are you looking into?
Yes, sure. I can go. So right now, as you can imagine, we are well established in France, and the one focus market is Germany. But apart from that, we are already now with partnerships and presence in EU5. So only with one or two pathologies so far now, and the idea is really to expand and provide our solutions to support patients in the maximum disease and pathologies. So we are speaking here about Europe, so I'm not gonna go too much beyond, but the idea is really to kind of become a digital and important actor in Europe, because we already launched one in the US, and the idea is in such competitive and markets, we need to first leverage kind of such markets to grow first and be able to compete against some big ones also in markets like the US, for example.
Awesome, thank you.
The home market, so to say, Germany, obviously. We are already active in Switzerland with health insurance companies who are offering our programs, and then soon Austria will be added as well. That's Europe at the moment.
Perfect. And so when you're thinking about entering new markets, are there certain criteria you're looking for? I mean, if we talk about the healthcare markets, everyone is always talking about the US as obviously the largest one, and then Europe technically is a big market, but of course it's very, very fragmented, and there are so many countries you could be going into. So I guess you really have to prioritize which one to approach first. So are there sort of certain criteria that you are using to choose a market? Is it maybe language and cultural proximity, or is it more the market size that you're going for? Are there partnerships or existing connections that inform your decision, or is it in the end purely opportunistic? Maybe Marius, you can start with us this time.
Yeah, these were already some good factors and reasons kind of to focus on, but I think language is definitely one important factor. It kind of depends how many products you have, because, for example, for HelloBetter, our courses or programs are based on cognitive behavioral therapy, and there's a lot of content involved, and translating content, there's this nice saying, content is pain. So it kind of, it takes time, it takes up resources, so it's not always easy to just enter a new market with a different language. So language is definitely one factor. That's why for us, for example, at the moment, Austria and Switzerland are quick wins, so to say, are easy to enter because of the language. Another factor, obviously, is the impact. How many people can you address, and how many people have the indication you're focusing on, and so that is related to the question, how is it reimbursed? And so these are, I think, two additional factors to focus on.
Yes, and indeed, definitely some factors to consider. There are many different criteria that we need to look at, and maybe just a few words, because I think we have quite a different business model than this reimbursement model, or like you, Marius, with HelloBetter. We are not really much focused on looking at the reimbursement so far. We are more working and offering sponsorships directly with the pharma companies that are looking to kind of strengthen the positioning and patient-centric approach through institutional support. And basically, this could be one of the criteria, really looking at the market, pharma markets, which are the players in the market specifically. So of course, easily, we wouldn't go first for the small markets, because we also look here at the financing capabilities. But yeah, culture definitely aligned with it. Culture, language, not sure we're gonna go right now to China right away. So we have also something that was or is becoming more and more important to look at, is all the digital maturity of the market. And there are some indexes, like digital maturity indexes, that exist where we can check different countries. I see that Serap mentioned also some engagement from different countries, such as the Nordics, that I believe is a nice, let's say, like try to kind of like go in the innovation and further. So this would be something, and also the momentum, looking, okay, what are the laws, regulations put in place, and I'm here taking the Germany as an example. So we saw this momentum coming in Germany with Jens Spahn that came in 2018. Not much was done before in digitalization, so he came, he wanted to move forward, put things in place, and it kind of like got our attention. So yeah, there are many criteria, I would say, but yeah, I'll let the discussion open, and yeah.
I guess that also means that whenever a country in Europe is now open or making the whole market for digital health more favorable, it would be quite likely that either of you could decide on going in there. So maybe that's also an incentive for some countries to make some changes, to make all these new options accessible for the people there. Roxane, you or both of you already touched on the language aspect and culture. And since you are already operating in different countries, was there anything you found, aside from obviously language, that you had to adapt between the countries, or were you able to sort of keep the same value proposition because in the end they were quite similar, or patient needs and also needs from the pharmaceutical companies you work with were similar enough, or were there any changes you had to make?
Okay, maybe I can start, and then Marius, I'll let you speak. But yeah, it's an interesting question, and I think I mean, we were working also with Flying Health a lot into looking at market entry strategies, and definitely apart from the language, definitely culture. I mean, the cultural aspect, knowing how to deal, how to do business, how to approach, how to speak to different kind of people. I'm not sure the approach would be the same with Italian people than German people. I mean, also just looking at very simple and concrete facts. It's meetings that I was like used to have, for example, in France or Southern Mediterranean countries. It's more into taking the time in the meeting. In Germany is way more straightforward, and a lot needs to be done in terms of really building the trust, which was also a challenging fact with the COVID happening and the fact that everything was done digitally. But happy to have also Marius challenging me on that and see how maybe you experienced also this digital world in doing business in Germany and in different countries. But definitely the cultural aspect is important in terms of our approach. Completely changed the deck, the pitch, the approach, the arguments, the sales basically arguments also to onboard our pharma partners onto such projects. And important also to really highlight all the data protection laws and so really reassure them on all these data protection aspects, GDPR compliance, and so on.
Yeah, I think I remember having a conversation with one of your colleagues about the main differences he's been seeing between France and Germany, and he was definitely putting an emphasis on data usage, data protection, and how much different you have to communicate that in Germany versus France. I don't know, Marius, if you have something to add as well.
I was just thinking the whole time, is there a big culture, like have I experienced a big cultural difference, in the markets next to Germany, which are Austria and Switzerland? Obviously there are like some small, tiny nuances, but nothing where I think we really had to kind of like take that in consideration, basically. Mm-hmm. So I think it was pretty much similar. And I think if you're discussing or arguing from a digital health company standpoint, things like evidence study, data protection, those are kind of most likely often same in different languages, kind of the importance if you're in that area. So yeah.
So I assume, Marius, you're also managing these two countries from Germany, right? From Berlin.
Yes, we do that at the moment. Yeah.
And
So,
Roxane, so you have opened up an office in Berlin. So is that something that you've sort of learned or noticed, that a new country does require you to have people on the ground? Or do you think you could be doing the same right now being in France? Or do you need that expertise locally?
Very good question. Definitely not. I need to be on the ground. So why do I say this? Is I mean, I'm taking again the example of Germany, since we opened the office in Berlin. I'm like, just for the context, I'm based in Paris, but coming to Berlin every 2 weeks because I see this need of personal connection, face to face, really being part of the ecosystem, being visible, building the brand effect, the image. People need to know that WeFight is not this French foreign company, that it's still still in France. They need to see that we are there and present, and they see us regularly in different events, conferences, congresses, and so on. And maybe it differs from one country to another. But I would say definitely for Germany, it is important. I do feel the difference. Even speaking about yesterday's event, one organized by Bayer, I just see so many easy connections being done in direct face-to-face, where I've been struggling online to get a response or kind of a reaction, because I guess a lot of organization and emails get kind of lost with the quantity. So it really eases the thing. And so definitely I'm on the team of we need to be on the ground, or if not, as much as possible there.
Got it. And is it are you also considering maybe just forming partnerships in other countries instead of always opening up a local office or always building up a local team? Would that also be an option for either of you to find partners to help with commercialization?
Definitely something we could look at. Just to put some context in terms of how we also choosing a country. Basically, we decided also to go into Germany first as a first international office, because we already had a kind of proven our proof of concept that worked. We already had 2 partnerships going on, and one partnership going on. We were like, okay, this is validating our approach also in the market, that there's a need, there's partnership opportunities. And once we have done this, then we decide to invest in resources, in terms of human resources, and also the installation of the entire team. But we're not, I mean, many countries are interesting today. We're gonna do also looking at which countries are having the most traction, and once we can focus there.
I can maybe go back to the point from before with being on the ground or not. I think the medicine, especially in medicine and healthcare, the human touch is super important, and so therefore I definitely agree that if you're trying to scale and grow with your company and you enter markets or new markets, you need to have someone there to actually be that one person who's creating and kind of fostering this human touch, that you're not just some random startup, student run maybe, but that you're actually a serious player within the field. So that is definitely important for success.
Yeah, I can imagine that communicating with all the stakeholders on the ground will be extremely important with just healthcare professionals. If you are looking at, HelloBetter, trying to get more prescriptions in different countries done, or if you have reimbursement secured, getting the word out there that healthcare professionals know about you is probably much easier when you have someone locally who can help you there. So both of you, so you started off in one country, and then at some point you went into different other areas. Was there a certain point where you decided now is the right time, or how long did it maybe take you from starting the business to looking at other countries? And do you think it was helpful for you that you had already sort of established yourself a bit in your first market or made up a name, is that something that then when you go into other markets, you can put out as a reference and people will say, yes, that makes sense. It's great to hear that you're already off there, or are you often met more with the idea that, oh, our countries are so different, our healthcare systems are so different, it doesn't really matter what you've done before? What has your experience been there?
I can go ahead. I think the magical word is pilots or pilot projects. In Switzerland, we actually did that with one health insurance company, and it took some time to set everything up. We invested time and resources, but in the end, it kind of paid off. And this health insurance company is seeing the value of our programs for their insured people. So, and then previously we've talked to another health insurance company in Switzerland, and they kind of heard of this collaboration, and so then we partnered with them as well. And they said that one of the main factors why we kind of jumped on board so quickly was that you had this pilot, that you already were in Switzerland, and in contact. We heard good things about you. So, and this was actually, the door opener, investing the time, setting up the first pilot was, and now it's kind of, making the name, being visible, and if you have a good product, then it works most of the time.
And to say a bit on our part, definitely helps to have like an established, like being like that, to have been able to establish like good partnerships and strong partnerships in our first market. Since our partners are also big names, we were really looking to leverage the entire network, the entire partnership that we had here to play as well on this side, to be looking at how we can take this local partnership, but also scale it in some of the strategic countries, because we've been, it was also an approach that was easy because they already know us. We already delivered some interesting KPIs where they could also use these KPIs to kind of convince the other teams, global teams, and say, look, this is a great initiative, innovative initiative that we launched. And we have these KPIs, it works, it has such impact on patients. We get this data about the success or satisfaction of such projects, and then it's easy to onboard. It's easier, let's say, never easy, easier to onboard also other countries. And I believe this was our successful approach. Right now, we do have a footprint in many different countries, and the idea now, and this is why the question was interesting about, okay, what criteria are you looking at? Because we could look at so many countries. Now that we have already established this, we are looking, okay, how do we approach this in an even smarter way, in terms of really looking at all the characteristics of the country, opportunities, even we didn't speak about it, but all the concurrent, like the competition, looking at who's there. Are they already 10 players doing exactly the same than you, or is it something completely new? And plan also ahead of timing, because if it's also something completely disruptive and new in this market, it also takes time for educating about such initiative and getting them also mature to understand the impact of such initiative.
I think the point on competitors is definitely a super interesting one that we hadn't touched upon. Sorry, Marius, I interrupted you there.
No worries. No, like one thing I wanted to add was kind of the DIGA model. How the DIGA light shines into other countries, kind of as well. So if you like once made it in Germany, you got their approval. That's another like quality factor that really can help a company to go international, because many companies, many international people are looking to Germany, looking how this DIGA model is working out with all its advantages and disadvantages. And once you're in that list, it means you have been in contact, you have been regulatory approved, and it gives you this kind of quality stamp, which is definitely important in terms of competitors as well.
I think that's a really nice thought there on the having a quality seal, having some kind of form of proof already to bring forward to other countries. And I mean, both of you have already touched on some success factors, on pilots, on references, on bringing that forward. What are maybe some of the main challenges that you have run into so far in going abroad?
Okay, I'll go ahead. The challenges, I think we touched upon some of them already in terms of what are the criteria we look at, because, for example, looking at Germany, I would say the fact about the culture. I mean, I'm half French, half German, but actually more French, definitely more French. And it's really an approach of it takes time to understand like the approach, and this was one of the difficulty. Sometimes it's it's not put as such an important factor, but it's one of the most important factor according to me. Really like taking the time to understand like what works, what doesn't work, what needs to be changed, to be talking all the time to everybody, trying to getting a name out there, because we come from not being there at all, not being connected to any of the partners or of the like flying health or events going on, to really being okay, we want to compete with the actors or the startups or all the digital health solutions that already have a name in Germany, already are here. So this was my I think our, like, from my experience, the biggest challenge.
Yeah, I think at HelloBetter, or in general for healthcare or digital healthcare startups, it's important to understand that there's not a one-size-fits-all solution when entering a different or a new country, new market. And so, main point, obviously, language and culture. I think another barrier often, or like something that people forget, is kind of the evidence. Is it actually kind of, if you do the study, for example, in Germany, and you enter a new country, is it still valid? So, and studies are not cheap. They take up a lot of time, a lot of money. So that is definitely, product and evidence in healthcare is linked so closely that it's definitely important to figure that out. And every country, I think every healthcare system is basically has its own dynamic. And really what you just said, Roxane, kind of figuring out who are the main stakeholders, where are they placed on the map, basically. Mm-hmm. Do they like each other, for example, how they're talking to each other? And so understanding this dynamic is crucial for success.
Yeah, I guess there are no quick wins. Sorry.
Yeah, and no, but like really good point, Marius, on this, because we didn't touch upon before, but really understanding like who's connected to who, and mm-hmm. This is like, it's not possible, and it joins the question you had, Laura, of do you need to be there in Berlin? These things are things I cannot get in a 30 minutes online call. You don't know like how the organization, I'm speaking here pharma, for example, how the organization behind, who's connected, how, mm-hmm. who's responsible for what, because it changes from one pharma to another. But also, going there, you see like who's speaking to who, you get the kind of like corridor insights, which are very powerful, and super on point, Marius.
Yes, there's lots of sort of gossip happening within the scene that you don't really hear about when you're in a different country. I think we have the same right now, looking at the French market and trying to figure out what is happening there in terms of reimbursement. It's definitely proving to be a challenge when you aren't there and hear all the little insights that we might get when we're here in Germany. And I think this already leads a bit to sort of the second part of the discussion where I wanted to go, is looking at this European perspective and in terms of harmonization, what kind of things maybe organizations such as visionhealth42 could be doing in the future in order to facilitate this market access. And of course, that's a really, really big topic. So I'm going to try to maybe break that down a bit and and have a chat about different things there. Starting off with Marius, because I think for you guys, I mean, reimbursement is probably one of the biggest factors. And you already you touched upon the thought of, okay, is evidence going to be applicable between different countries in Europe? If you could imagine sort of the ideal process for reimbursement across the European Union, what would be the best way out there for you?
If I would knew that, I would fund my own company. That is probably hard to figure out. I think that there's not the one golden answer, so to say.
But what should be done on the European level to make it the best for you? Like, what would be the ideal state sort of there?
Yeah, I mean, obviously create a framework where like all relevant stakeholders should be involved, should have a place at the table, and see what has worked so far. And kind of, Germany is often the role model with the DIGA concept, and kind of see what works and what doesn't. At the moment, for example, in Germany, over the last months, there were many talks about prescription numbers. Now it's going more to price negotiations. And so it is like a living model, so to say. We're learning every day, every week, every month, a little bit more about how it's going to evolve. And I think at some point you can actually say, okay, we will never learn enough, but it's kind of has progressed, and we can take this model in Germany and adapt it with all those relevant stakeholders on a European level to kind of fit, or at least build it step by step, so you don't need to have the 100% solution, but use the blocks, so to say, which have proven to work, and find a way that kind of is working for all other countries as well in Europe. But it's a huge challenge. Yeah, definitely. Absolutely. But yeah, evidence, kind of to concretely answer your question, the evidence and the application process should be really transparent. What is being asked from the company, what kind of evidence is being asked, and just transparency to break it down.
Yeah, no, I think transparency is a really great point there, and definitely something that also organizations such as visionhealth42 can put forward and make sure that is being heard on the European level, what the companies need and how that needs to be communicated back to everyone, so that everyone knows where they stand and can make better decisions on which country to target next, and hopefully do it more quickly so that more patients get access more quickly as well. I think some of the or one thing we haven't really talked about, and I'm not sure how much of an issue that is for you, but of course every country has their own digital health infrastructure, sort of, or in the case of Germany, is still building that up and is probably a bit behind what other countries have done. But is that also something that you have to take into consideration of how you can work within that national infrastructure, or is that something that for your product is not as applicable, not as important for you to be looking at interoperability on a European level?
No, that's super important. I mean, the way to go is often put yourself in the user's or the patient's shoes, so to say, and look, how again, it's all about the networks, which are the pathways, how do you fit in those pathways, which are different in each country, and having then the interoperability is definitely important, kind of, to even go a step further and exchange the data and information. Because, yeah, as you said, in Germany, we're a little bit behind when it comes to electronic medical records. But that's definitely a good point.
I can only agree with the interoperability, and looking at like to advance, and not actually even speaking about the space where we operate with our solution Vic, but it's as a main, like, there's not one country, I guess, that I think that has the same kind of like numbering form of social security, for example, and how do we do that to have it on a European level? What did I want to say? Yeah, we have, for example, also another another solution, which is basically connecting the patients with a dashboard implemented in the hospitals. We have it launched in France, and looking at on a European level, the idea is to be like, how can we improve this interoperability, because we have one partner, but it's only in France. So yeah, meaning how does it work to kind of implement this in the IT systems of hospitals in Germany, for example? And this, I'm not sure I have the response yet. So.
It's probably still some way to go there. I mean, this interoperability often comes with standards, and I think there's quite different opinions or views on standards and how good they are to foster innovation. I think some would say if there are too many standards or regulations that are put in place, that will hinder innovation. At the same time, I often feel like on a European level, it might be nice to have a common standard, or probably it is about not having different ones in each country, but having one common standard. But would that be something that you think on a policy level, organizations such as visionhealth42 should be lowering towards, or should be going for, saying that we need standards, and that might mean that there are additional ones, but would that be helpful for you to, or do you think that would be helpful for digital health companies within Europe to have maybe even more frameworks there that they could navigate between, or is that completely too much and it will just hinder innovation?
If the advantage is bigger than the disadvantage, I would say yes, you go for the standards, and I think the answer can be as easy as I said. Obviously, we have to avoid creating more and more intransparency, so to say. But clear rules definitely help.
I quite like sorry. Awesome. No, I quite like the definitely more advantages than disadvantages. I would agree personally as well. But I think that can be something that can be put forward over the next, hopefully only in the short term on the European level, not just on the long term. I think one thing that I thought about when thinking about going Europe, and also thinking about policy changes and what visionhealth42 could be doing in the future, and I'm sure they have lots of ideas, so we can just add to that. But probably the policy level is not going to be quite enough. And we see that in Germany, we now have reimbursement mechanisms, we have certain things in place, but I think adoption is still very much dependent on patients and on physicians of actually using something. Do you think that there is also a space for, I don't know, education, awareness campaigns on a European level, or is it because the healthcare systems are so nationally organized that will just have to be something that needs to be done in each country individually, or can it come from the European level as well?
Yeah, I mean, when you speak about awareness campaign, definitely something to do, but the question is also at the European level it would be great, but the question is like how do we make it impactful? How do we gather everybody, like from the different countries together, or the different actors? Because I'm thinking of for example, like what we want to do. And for example, I remember now, like more the HIH, like Health Innovation Hub event in November. I was also there. It was interesting because you see 7 countries on the stage saying, yeah, we want to do it, it's great. However, I look online and I don't see any updates on where they are in their reflection. What do they actually gather, like on a regular basis with the German authorities to understand, okay, how are the advancements? I mean, I'm just asking questions here, but I think before even going into awareness campaigns, I think there is an opportunity to organize maybe some more gathering or interaction between all these countries. It's really about communicating what works, what can be replicated, what needs to be adapted from one country to another, and taking the example of Diga. Exactly, like we see some small adaptation for France, where France really wants to copy this fast track process, but in the end also adapt it in terms of the application. On one side, application and telemonitoring. But yeah, the idea is like, how can Vision Health 42 also take all these actors from different countries and organize these events, these talks, to try to advance the discussion, but also then to have a monitoring, because a lot is being talked, but what are the actions? And this is also a bit, I would say, not only my frustration, but I guess in general, where institutions are not as fast or dynamic as probably startups or scale-ups, and we're like looking at how can we accelerate this movement to have this Europe as one.
I try to keep it short. No, I think education is always important, and I would say kind of depends on the target group. For example, if you would tell like a primary care physician outside of Germany, there's this DIGA model in Germany, he or she would probably not care because it's not affecting them directly in their day-to-day business. On the other hand, if you would bring up the topic to a medical student, outside of Germany, and kind of say, okay, this is a journey or this is the pathway of medicine, where it's going to be, where it already is at the moment. And so kind of, harmonizing what is happening in other European countries, basically, and create kind of a union.
I think that's a really interesting approach that we haven't talked about at all, about healthcare provider education and starting already in their first education, basically during their studies, and how that could be something to be addressed on the European level. I think that's something we should keep in mind and maybe push towards, because I do think that can make a big change moving forward to reach a lot of people that have quite a lot of power in healthcare and are the gatekeepers in a way to reach more patients. I feel like you already sort of had really nice summary sentences on what maybe is needed in the future, which is something I was going to ask you to finish this off. So I think, we've we've seen that it is quite a heavily regulated market, the national systems are quite different, and that you have to navigate them, that you have to learn quite a lot on each country before you can successfully enter. But we've also seen that you've done so already, that you're still doing so, and that you will be pushing towards that, and we'll probably learn even more along the way. So if I ask you a year from now, you'll probably have even more lessons learned that you can share. But maybe one last round, is there anything left that you feel like we haven't touched upon that you still wanted to mention, or otherwise sort of your biggest wish to happen on a European level to make this easier in the future? Big questions for the end.
Yeah.
Go.
That's a good question. I think there are probably a million things that one could say, but aligning on the goals in healthcare, and that is basically to help the patient, and then kind of put aside maybe your own interest and think more of the patient's interest. And so I think that is when we all align on this, we make the world a little bit better.
Nicely put.
Yes, I would just, as a last maybe finishing word, mention there's definitely some harmonization to be done in Europe, and I'll come back to a point I mentioned at the beginning of we need to be like working together and harmonizing this to be able to scale more rapidly when we see that some other markets such as the US, I'm sorry to take again the example, really leading the way and advanced, and and I know that on our side, WeFight has the ambition to kind of also implement itself in the US, but we see like huge actors that we need to compete with. That's why it's first looking at Europe and how to establish ourselves not as a French actor, but as a European actor. And I'm taking as a last word the example of really pushing forward all these initiatives of Vision Health 42, but also Flying Health, EIT Health. On our side, this helped us a lot in entering specific markets, but also EIT Health looking at like Europe in general and leveraging these kind of networks and accelerators to have a unity and as a company to be able to efficiently and more rapidly, let's say, enter a country.
Awesome. Thank you both so much. So I think we can summarize and say that we're looking forward to what Vision Health 42 will be doing over the next few years and hopefully make a big difference for companies such as WeFight and HelloBetter in scaling their products to a lot more patients. Thank you very much for joining me this afternoon, and best of luck with your journey.
Thank you, Laura.
Also, thank you from the team of Vision Health 42. Thank you to Roxane. Thank you to Marius. Thank you, Laura, for your wonderful moderation. And thank you, Roxane and Marius, for your very interesting insights from a perspective of a startup. And Marius, welcome in Austria. You mentioned that one of the next markets will be Austria. So it's very nice here today, sunshine. So you are welcome. Roxane, you are welcome as well every time. And you're right. At the end, it's the patient. It's the patient who is in the center of interest, and it's the patient for whom we are doing all this, because we want to accelerate this very wonderful movements in Europe. So these technical developments, these new technologies, these new digital health apps and other technical developments, and we want to bring these new technology to the patient as soon as possible, because he or she is then the person who needs this. And we want to build a bridge between the European countries, because the challenges you are facing in your countries, the same challenges have other startups in other countries, and that's why we started this initiative. And we want to bring all these stakeholders together, and also the politicians and also these persons who at the end make the regulations, because they should know about your challenges and about your concerns. And we want to make this kind of channel of communication through Europe and through all stakeholders, not only startups, not only the industry, not only the doctors, all together, because we are all together for one goal: to help the patient. And this is the reason why we started this initiative. And thank you all for making today afternoon a very, very valuable contribution. And I'm sure that our listeners and viewers, either today or in the future, because you can see this film then on YouTube, will have very good inputs and insights in what you are doing and what should be done in Europe. Thank you, Laura, and your team for Flying Health, for enabling this session and for doing this afternoon together. For the future, please follow us on social media, on LinkedIn, on Instagram, on Facebook, on YouTube, and you're very, very welcome on our website. There we will publish our news, and there you can register for a newsletter. Thank you to all of you, and also you haven't seen them, my colleagues from our team, they are sitting backstage and they are doing the technique so that we all have our micros and that we see and listen to each other and that the other people can see and listen us. These people are Susanne Kosian in Rome, Roman Cichi and Miriam Speth in Germany, in Hanover and in Munich, and Clara Kota-Isaka in Vienna. So we are distributed around Europe, and that is why we started this initiative. Europe and the patient in Europe is most important. Thank you all together, all the best, and good luck for the future. Thank you.
Thank you.
Thank you. Bye-bye.